All right, good evening, everyone. Welcome. Hello. Good to see all of your smiling faces again this week on Zoom. Or if you're new tonight, welcome. My name is Dr. Stacy Holbeger, and I'm so excited that you decided to join us to hear a little bit more about LifeWaves technology in this 30-minute informational Zoom. And that's exactly what it's going to be. It is going to be informational, educational. I do have a little bit of time here for some people that want to share their personal testimonials. So if I have one or two people that want to be able to pop in here in just a little bit, just for 2 minutes, 3 minutes max, type that in the chat. Let me know that you want to share your testimonial, and I will unmute you here in just a little bit. So I'm looking forward for hearing some new testimonials tonight, because that's what it's about too. And then at the end, we'll have a Q&A. So you'll be able to type your questions in the chat, and I'll be happy to answer those after I, of course, go over all the information. So before we get started, please know that I'm not a medical doctor. I have a PhD in integrative medicine and a PhD in functional medicine. So I focus in the holistic alternative world of healing modalities and tools in my toolbox. And if you have any questions about your specific medical health condition, medications, whatnot, of course, you're going to check with your doctor or practitioner. Not going to make any claims to treat or cure anything. Of course, we have incredible testimonials, we know, but please make sure you know this information is for informational purposes. So with that being said, this is what our technology looks like. This is a wearable light technology. This is LifeWaves X39 stem cell activation patch. Now, I want to explain to you how this works. And really, I think the best way to do that is to talk about patches in general and what they do. Patches such as nicotine patch, hormone patch, birth control patch, weight loss, pain patch, those put some type of chemical or medicine or herb or nutrient through the skin into your body, right? That's what they do. They transfer. They're called a transdermal patch. So this is non-transdermal, meaning when I put this on my body, nothing is entering through my skin into my body. No medicine, no herb, no chemical, no nutrient, nothing. So how does this wearable light technology work then? So let's talk just a little bit about light therapy. I'm sure you guys are familiar with light therapy. People have been in infrared saunas. Anybody in here? I see hands going up, right? Cardiovascular benefits, detoxing, anti-aging. We see lots of benefits in pain and inflammation from infrared saunas. It's just different wavelengths of light depending on what button you push, and that helps to do whatever it is in your body. How many of you guys have ever done any red light therapy? I know when I went for my facial last week, she put on the mask and then she put the red light therapy over my face to enhance collagen and elastin production. So we know red light therapy is used in estheticians. We know it's also used as pads on the body, or even beds you lay in for full body red light therapy for pain and inflammation and helping support the body, the mitochondria. I saw last week on a thing on social media, there are ball caps that have red light therapy inside of them now to help stimulate hair growth. So we know that those are different wavelengths of light, right? How many of you guys have ever used any laser therapy? Red light, blue light, cold laser, maybe from your acupuncturist or your chiropractor? Different wavelengths of light, doing different things in the body. And then finally, how many of you guys have ever been in the sun? Anybody ever been in the sun? I think you can tell I've been in the sun. The sun loves me, right? You can see this, the color of my skin. So we go out in the sun and we know wavelengths of light elevate melanin, which give me this color. And wavelengths of light elevate vitamin D in the body. Okay, so you understand how patches work. You understand how light works to create change in the body. We got that down pat. So how does that pertain to this technology? Well, the beautiful thing is when I put this on, I put it on in the morning when I get up, when I'm brushing my teeth. I can put it on the back of my neck. I can put it below my belly button. I can put it right here so you can see it, or I can stick it somewhere where you can't see it. It doesn't matter. I can put it anywhere on my body. But when I do, a wavelength of light from the patch enters my body. How does that happen? Well, if you put your hand on your chest, you're almost 100 degrees. That 98.6 degrees, that body heat that you emit, or a low-level infrared light, that is the power source for this patch. Well, we don't need the sun. We don't need a sauna. We don't need a laser. Well, we just need our body. The patch does not work in the package. It only works when you put it on. We are the power source for this technology to work like that. A wavelength of light enters your body from the patch. Okay? So that we can understand, right? Light therapy, wavelength of light enter my body. Now we want to know, what does it do? So let's talk about peptides. You guys heard of peptides? Some of you have. Peptides, you have thousands of them in your body. But this X39 activates one very specific peptide. And that peptide is the superhero of peptides. It's your Superman of peptides. It does so many different things. It has so many different superpowers. This elevates GHKCU copper peptide. GHKCU copper peptide. You can go to PubMed and you can type in GHKCU. You'll find 13 pages of research and benefits on using GHK. Of course, they're talking about injecting it, right, or applying it topically, like estheticians do to our face for anti-aging, those wrinkles and lines and circles and stuff. But we're actually talking about elevating GHK with a wavelength of light, which means it's non-invasive. There's nothing entering the body, right? We know that it works instantaneously to elevate GHK. GHK is known as the fountain of youth. And not just the fountain of youth on the outside, but the fountain of youth on the inside. It is a peptide that declines as you age. So what happens when you elevate GHK? We have not enough time to go over all of it, but a summary is we immediately see the upregulation or resetting of over 4,000 genes back to their young, youthful, healthy state. That is powerful, right then and there of itself. GHK improves cardiovascular function. It improves neurological function. It helps with sleep, with pain and inflammation reduction. It helps with wound healing. I have surgeons on my team that require at least a month pre-op and 6 months post-op of their patients using the X39. They find a 40 to 50% reduction in healing time. They used to just do a couple months after, and that's when they were seeing that 40 to 50%. But then what happened, which is what I'm going to talk to you about next, they saw the patients that stayed on the X39, they would come back for their final, evaluation and appointment, and they would report all these crazy improvements in their health, their arthritis, their joints, their knees, their aches or pains, their sleeping, all of the medicines they were able to reduce or come off of. They're like, what is in this thing you're giving me that I've been wearing before I had my surgery for whatever issue, right? They had no idea. And so they've, of course, decided, as we do as well too, that you continue to patch for a certain amount of time, and that's based on your age. 1 month for every decade you are old is that how long you need to patch to wake up all of your dormant stem cells. That's why they were seeing that continued improvement in their health issues, because GHK elevates, activates, and mobilizes your own stem cells. And stem cells are the holy grail of healing. They have the ability to go to anything, any area in your body, and repair and regenerate it. That's what stem cells do. You were born with an abundance of them, and as you've aged, they've declined. They've become dormant. That's why 5-year-olds don't have heart disease and 10-year-olds don't have gray hair, right? Their bodies are young and youthful and vibrant. But as we age, we start to see that degeneration process. So this immediately elevates GHK and starts that process, and over time, waking up those dormant stem cells. How do we know this? We've measured it. We have double-blind placebo-controlled studies that show we are actually doing exactly that in the blood. We have a patent that states that. That's why this is a patent in technology. You won't know what wavelength of light it is, because we are doing something that no one else on the planet is doing. We are elevating GHK and activating, mobilizing stem cells, and your own stem cells are going to work to repair your body. Now, here's something, and I asked earlier just to make sure, if anyone wants to share their personal testimonial tonight, just 1 to 2 minutes, please put it in the chat and I'll unmute you here in just a little bit. I'd love to hear 1 or 2 of you share your personal experience. But before we do that, these are the 2 most common questions that people ask me. Number 1, they say, Will it work for whatever disease they have, whatever condition, whatever syndrome, whatever symptom, whatever issues they're dealing with in their long grocery list of problems? Everyone wants to know, will it work for this? And I understand that. Of course you do. That's why you're here. You want to know if it's going to help you. The answer is 100% yes. Yes, it will help you for anything, everything. Let's go back to stem cells. Your own stem cells. Your body's smart. This activates the body's ability to turn on those stem cells, working to repair and regenerate whatever's needed in your body. That's what they do. That's why they're the holy grail of healing. So yes, it'll work for everything you have. The second question they ask me is, how long is it going to take? And that answer is, I don't know. I have no timeline for your body's healing ability. You can't determine where your stem cells go. This is not an injection, right? You didn't pay $25,000 to put this patch on. This is a couple bucks. So you're going to use it over time to wake up and reset those stem cells so they're young and youthful, and they're going to go seek out the areas that are needed most. You may be saying, I need this so I can avoid a knee surgery in 2 months. And your stem cells say, I'm sorry, honey, your liver shot, we're going there first. So you're going to have to be patient, right? They're not going to tell you that. So you're just going to have to be patient. Your body will determine where your cells go. And so that's why I say, I don't know how long it will take for you. I don't have a timeline. I would never, ever, and no one should ever tell you that you would have these results in this time frame, or otherwise it's not working for you. It just doesn't work that way. And then I have people tell me, well, if I don't get results in 30 days, this is not working, I'm not using it. And I say, well, then you're not even buying it, because this is not a 30-day program. That's not how this works. So let's just talk real quick about the clinical studies, just so you can get an idea of what we see in the body. So you're about 80% of your people in the first 3 to 6 weeks. Now, this is not 100, this is 80. In the first 3 to 6 weeks, they're going to notice changes, like I mentioned, reduction in pain and inflammation, better quality of sleep, more mental energy, clarity, focus, concentration, more physical energy, faster recovery, like I said, better sleep, of course, and then the wound healing, right? Faster wound healing from accidents and injuries. That's 3 to 6 weeks. We really start to see significant things happening at the 6-week mark. We can see changes in your cardiovascular system. Now, you may not feel them, but we see them. The heart is functioning. The vascular system is functioning 2 months younger. Every 6 weeks you patch with X39, 2 months younger in your cardiovascular function. So you use that over time. You're going to get years knocked off of your cardiovascular system by using this patch consistently, day after day, week after week, month after month. We also see changes in the brain at 6 weeks. We can see a reduction in anxiety. We can see improvement in coherence, which means the right brain, left brain communicating with each other, which leads to better cognition, communication, memory, things like that. Those things don't happen in a couple days or a couple weeks. They start at the 6-week mark, and we can see progression as people continue to patch. We see collagen production increase around 90 days. You're like, I don't care about my hair, skin, and nails. That's what collagen's for. No, it's not. Collagen is the glue that holds your body together on the inside. You want to know why as you age, things creak and crack and things fall apart on the inside, and your metabolism's shot and your digestion is shot, and you're just like, oh, gosh, I have aches and pains and all that. Your collagen is declining 1% every year after 18. I Zoomed with a lady a little bit ago, and she was 86 years old. And so she was asking about collagen. I said, well, girl, you've lost 60% of it. It's gone. Now, it's not going to take, 60 years to get it back. But we're going to start to see improvements in your collagen production around that 90-day mark, and of course continue to compound as you keep patching. So give it a year, give it 18 months. You're almost 100. You'll be fine. Keep patching, right? What do you have to lose? You have nothing to lose and everything to gain. And so Anyway, we talked a little bit about, that collagen production and what happens after that 6 month mark. That's that 12 month mark, that 18-month mark. And I don't have time to go into this. Tonight, I interviewed two incredible men on Tuesday night, Jeremy and Bob, and their testimonials were just priceless of their 2 year and 5 year journey and what they were able to accomplish pain free, coming off of multiple medications, just their quality of life from not wanting to live to now living the best life possible. Both of them running around with grandkids. It's just remarkable. So whoever invited you here tonight, please ask them for that recording for Tuesday night. It was so good. So we do have, let's see if we have anybody in here that wants to share. Nobody wants to share their personal testimonial. Wow. Anybody want to share? Pat, you're on here.
Miss
Pat,
Pat does.
first Pat. Good. Okay, Pat. I was like, Pat has a great testimonial. Let's get you unmuted, Pat. I love your testimonial.
Thanks. Yeah, I do have a great testimony. I've been on thyroid medication for 30 years, so that's something that I'm really cautious about getting off of. So I took a year to gradually do that with my doctor doing blood tests, and I just kept reducing on my own. I'd tell him, well, I'm going to cut this down. And he said, okay, we'll check you in about 3 months. Well, I'm totally off thyroid medication. And that's been since December. So that's really great. My husband had shoulder surgery when we first signed up. And so he was already scheduled to do that. So even though possibly he could have been using the patches and not had that, he had already waited for such a long time after falling in handball. So he started patching a few days before surgery and continued, and he was on the handball court in 6 weeks playing with this total shoulder replacement and no pain and no pain after surgery. And actually, he had surgery and went home that night. So he didn't even have to
Wow.
stay overnight. So we've just found amazing things that have happened. And he lost 25 pounds on the patches when he started using the energy patches. He had been patching for maybe 9 months. And then I said, well, why don't you try the energy patches? And so I was surprised that that was great.
Wow.
And our sleep has improved. Like you said, all the things that you listed are just, we really appreciate.
I don't think I knew you were off your thyroid medicine after 30 years. Did you share that part yet?
I did on one of Jules' calls, but
I must have
yeah,
missed that for
so
some reason.
it,
Congratulations. God, that's huge.
oh, it's really huge. It's really awesome. And so, and last night it was like I slept so deep. It was like shocking because sometimes I'll get up once in the night and I woke up in the morning. It was just such a deep sleep. And that's just gotta be the patches because that was one of the very first things we noted within 3 weeks that we were sleeping deeper and better.
Congratulations. Thank you.
Thanks.
Thank you for sharing. Thank you to you and your husband. Okay, Tracy. Tracy said he would share. Where are you at, buddy?
I'm here.
Perfect. Are you in Ireland?
Yeah, so I'm sorry.
Are you in Ireland? Where are you?
I'm in Vancouver, Washington, but I love this picture of the Irish Spring that we took about 8 years ago. Yeah, so about 10 years ago, I hurt my lungs breathing toxic smoke up in Chiang Mai, Thailand, and it became really bad reactive airway disease. And every cold season, I'd go from a cold to bronchitis to asthmatic bronchitis to really bad, like often even pneumonia. I'd end up on high dose steroids, like a steroid burst, like 20 to 40 milligrams a day of prednisone for 10 to 14 days. That is a lot of steroid. And actually, that's why Lori got me on the LifeWave patches, was to stop me from coughing for months and months on end. And now I have gone 2 years without a cold, without bronchitis, without asthma, without using all the steroid inhalers, and without a single steroid burst. That is just like priceless for me.
That is huge. I didn't know that, Tracy. That is incredible.
Yeah,
Congratulations.
yeah, yeah. That smoke in Chiang Mai, Thailand, it's during burning season, it's the worst air in the world.
Wow. They want to know what patches you used.
Oh, it's the It's the X39 and the glutathione.
X39 and glutathione. Wow. Glutathione's our big immune booster, antioxidant, detoxer. Wow, that improved your quality of life. Oh, wifey's here wanting to share. All right, Lori. She's got more
No,
information.
also, I think you forgot this, but like I had energy enhancer over the axillary areas because I wanted to move his lymphatics. So I had all the patches mostly on his chest because he was coughing for 4 months straight. And I looked at him, I would look at him and go, I don't know about you, but I'm getting tired of hearing you cough. It's terrible. I know that's terrible.
Okay, well, that's good to know. Energy enhancer to move it on up here. Thank you. Well, thank you for sharing. I appreciate that. Awesome. Thank you both. Congratulations. No one has to hear that coughing anymore, right? Not to mention all the benefits that Tracy's feeling on the inside, not having to be on all that medicine. So, well, thank you guys for sharing. Okay, we've got about 9 minutes left. I would love to answer any questions that you have. If you want to throw up your hand on the, screen, if you want to unmute yourself, that's fine. Or if you want to type it in the chat, please do that. I'm happy to answer any questions that you have in regards to anything about the technology and what it is and how it does work for whatever, if you didn't understand some component of it or you have a personal question or something. Now's your time to shine. Any info on alopecia? So when we look at hair loss, obviously that's an autoimmune condition called alopecia. Regular hair loss is not from that, but autoimmune. So we're looking at the immune system in the body. Of course, we support our immune system with our X39. We know it does elevate glutathione about 30%. Anytime you have any diagnosis, we are going to use Aeon next. And for those of you that are guests tonight, we do have 10 patches David's invented. The company is 20 years old. So he has invented those over the last 20 years. The X39 has been on the market a little over 5 years now, but we did have other patches before it. And so they're what we call supportive patches, and they support different systems or organs in the body, and they work synergistically in conjunction with X39. Of course, they work by themselves. They did perfectly fine for 15 years, but we do use them together to partner up to address certain issues that people may have, right? If they want to. You don't have to. You can use X39 until the cows come home, right? Bob did nothing for 2.5 years and except X39, and he had great results. Now, skin cancer gone, prostate medicine gone, urinating issues gone, pain gone, all the stuff. So it depends on you, but we would add Aeon because we have a diagnosis. And then from there, we would look at supporting that immune system with our glutathione. That would be very beneficial. Can the X39 patch be placed any other places except the stomach and the back of the neck? So any spot on your body works. It doesn't work in the package, but it works anywhere you apply it. When you elevate a peptide in the body, there's not one specific spot that elevates that peptide. The peptide's elevated because your body's heat is interacting with the patch, and that wavelength of light immediately goes in and targets that peptide. That's what light therapy does. It targets certain things in the body, different wavelengths of light. So it doesn't matter where you apply the patch. Anywhere. Leave it on 12 hours, take it off, throw it away. Put on a brand new one the next day. So any spot works. Women in their 50s with hormone issues, any information on PCOS, ovary issue with a 16-year-old. Okay, so again, let's go to balance, right? Remember, any disease, any issue, any condition, 100%, yes, use your X39. If you're 16 or if you're 60, it doesn't matter. Use your X39 every single day. Again, diagnosis, I would love for you to support that inflammation process in your body with the Aeon. That would be your absolute next go-to. When we look at hormonal support, we're going to look at SP6. SP6 balances the endocrine system for whatever hormone issues, and that is the set of glands and organs that are responsible for hormone balancing in your body. So you could use the SP6 in addition to the X39 and the Aeon. So yes, you would get up in the morning and you would put on 3 patches, and you would leave them on 12 hours and you would take them off and throw them away. And then you would get up the next day and do the exact same thing. All right. Any other questions? Adverse? Okay, here we go. Good. Any adverse effects reported? We have over 90 clinical studies that many of them are double-blind, placebo-controlled, peer-reviewed even studies. We have 0 adverse side effects in any of our clinical studies, and we have millions of people around the globe. We are a global company. We're in over 82 countries, and we have no reported adverse effects or side effects or interactions or contraindications to any medications or supplements or foods or anything like that. So we're very familiar with prescription meds. When you get a prescription med, it comes with a pamphlet with usually 5, 6, or 7 pages of side effects, right? Potential risks and side effects or interactions. Don't take this if you're taking this and blah, blah, blah. We don't have that. Nothing. Nothing at all. 0, which is so refreshing to know that we're completely safe. I've got my home up to 80 degrees in the summer. Are my patches okay, or were they activated? So no activation for your patches in your house at 80 degrees. The patches work when we put them on the body, and we are about 100 degrees. So they interact with us. We're the power source. We emit a low-level infrared light or heat. Right now it's getting dark outside here in Florida, and I can't see my neighbors or the animals outside unless I was looking through night vision goggles. Your house isn't putting out infrared heat, right? Like that. We are, right? That's thermal imaging. We can see that. That's what our technology works with. Now, don't go leave them in your mailbox at 105 degrees for a week while you're on vacation. They're probably not going to be effective, right? You're baking them, literally, like cooking them in a microwave. So don't go do that, okay? But yeah, they're totally fine sitting in your house at whatever degrees. We keep our house at like 74, 75. It's perfectly fine. Good question, though. All right. Is there any reason that someone who is not a brand, not on BP meds, not on blood pressure meds, would have a lowering BP after starting patches? So we know from our studies that these patches increase oxygenation, they increase circulation, they get things moving and flowing, they impact the mitochondria, which is the powerhouse, the ATP, the energy source of your cells. And so if your blood pressure is a little bit lower, or if your heart rate may be a little bit lower, it's a regulation process in your body. Your body's kind of like sifting and sorting through things, okay? So it's not worrisome or scary. It's not going to bottom you out, right? That would kill you. Obviously, it doesn't happen. So don't worry. It's not like you need to be concerned. Probably, this is my not medical person advice, but you're probably dehydrated. So we know when someone's BP drops, they're going to pound the fluid, the IV fluid in them to shoot that BP up. So you need to make sure, as with always with the patches, you're staying hydrated, at least half your body weight in ounces every single day in water, more if you're consuming caffeine or alcohol. So I would look at your hydration level. That's a very good indicator of a low blood pressure. And again, we're moving energy, we're moving things through the body. You need to hydrate to keep yourself in the tip-top shape, okay? Any feedback for someone who has had AVF? Don't know what AVF is off the top of my head right now, Jessica. You're going to have to tell me what that is. We don't do trials or tests on any kind of diseases. We don't look at any disease. We look at organ function and system function. So when you're looking at Alzheimer's, we're looking at the brain. Do we see improvements in the brain? Oh my goodness, we see improvements in the brain. You've got your X39, your 49, your EON, your carnosine, your glutathione, Alavita, SP6, they all impact the brain in different ways. We see huge neurological benefits. I've interviewed numbers of doctors talking about neurological benefits with our patches. And of course, all of our clinical studies will show that as well too. So we're not looking at a disease, we're looking at the function. If you have Alzheimer's, something's not functioning correctly in your brain, probably looking also not functioning correctly in your gut, right? There's a huge gut-brain connection there. So you would use those patches for that, right? Jessica, oh good, you asked her, thank you. And we've got 30 seconds left. Where would you place the Ice Wave for pain in main joint of your little finger? good luck. I don't know that it's going to wrap around that baby finger and stay there. So we have a white and a tan patch. You may try on the back of the hand, or you may try on the front or the side, the finger. You're going to have to play around with it. You use a white and a tan. So just play around with those ice waves and move them around and see if you can get them to, again, they're not meant to wrap around usually and stay like that. They stay pretty flat, but you'll have to kind of play around with them. Use your Eon, your X39 in those areas as well too. Jessica, I have no idea what that even is. So not being a medical doctor, I can't say. It sounds like it's brain, so I would go back to the patches I just stated on the brain. But again, we don't look at the body in terms of diseases. We look at there's an imbalance, and so we want to help balance that organ. So you want to help balance the brain. And again, X39, over time, you're going to get there, right? It's just what stem cells do. They have the ability to heal anything. So thank you guys for being here this evening. I'm sorry we're out of time. I've got to hop on another Zoom, but we will be back together next Tuesday, of course, at 8 p.m. Eastern on this Zoom, and then next Thursday again as well here. So please come back, bring some people that you care about and love, and get back with the person that invited you. They're going to be able to answer your questions. We're all connected and work together, and they're going to be able to help you with what patches serve you best and your family members, and help you build that wholesale pack so you have the ability to get the best pricing for the patches you want for you and your family. So thank you guys, and I'll see you on Zoom again soon.